what triggers heart attacks.
India is the heart attack capital of the world.
What are the earliest warning signs?
Cardiac pain will be like 1 or 2 kgs of weight on your chest. The moment you start walking, it is increasing. The moment you start resting, it decreases. The moment you go uphill or uphill the stairs, the pain starts increasing. 4 numbers are more important than all the 256 lab tests put together.
A silent heart attack.
Your competition when you hit the gym is not with a Bollywood celebrity or a Photoshop copy of a Bollywood celebrity. Pre-workout turns you into a beast mode. Your power increases, your exercise capacity increases, but your heart rate goes up, your blood pressure goes up. After the gym, pre-workout, you've taken alcohol. It's a deadly cocktail mixture.
Is heart damage reversible after a heart attack? Hello and welcome to India TV. I am Shivangi and you are watching HealthDNA. Well, we often think that heart attacks are just for the elderly or sick, but this can happen to anyone and any time. And many people don't know about the real warning signs. So today we are in conversation with Dr. Amit Bhushan Sharma, who is the head and director of cardiology from Paras Hospitals Gurugram, and he will help us understand what triggers heart attacks, the warning signs, and also will get some life-saving tips to keep your heart healthy. So welcome to India TV.
Thank you, Shivangi.
Now, sir, as we are seeing that there is a rise in cases of heart attacks and in fact cardiac arrest as well. But what are the main causes of heart attacks today that you see commonly in, patients?
So as you rightly said, India is the heart attack capital of the world. Majority of the patients are having a peak age of heart attack between 35 to 55, which is about 10 years younger than the Western counterparts.
Yeah.
The causes could be modifiable or non-modifiable. So non-modifiable factors are genetic factors. It may not be your father or mother, but if your maternal aunt, your paternal uncle, anybody in the family has had a heart disease before the age of 60, your chances of having a heart disease is 3 times higher. The guidelines differ, the types of tests differ, the frequency of tests differ. Then the modifiable factors are the lifestyle factors, diabetes being the major one, hypertension, cholesterol, lipids, cholesterols, smoking, pollution, sedentary lifestyles, stress is a major killer, come next after all that.
Okay. But sir, before we move ahead, many people have this question in their mind that is heart attack and cardiac arrest same or are they different? So what is the difference between both of them?
See, heart attack happens when your blood vessels, 3 major blood vessels of the heart, one of them gets blocked, the heart muscle dies, you have a heart attack.
Yeah.
So in that time is muscle. If you do not act properly, it can cause a heart failure or it can cause a cardiac arrest. Cardiac arrest means that the heart has stopped functioning totally. There is no pulse, no BP. It is a terminal event. At this point of time, you would require a cardiac massage, a resuscitation, a ventilator. So until and unless if you treat the heart attack in time, these things will not surface.
Right, sir. But as you said that, if you have something in the genetics, then there are 3 times more chances that you can, have a heart attack. But can a heart attack still strike someone with no previous heart disease as well?
Very rightly said, younger patients as compared to, let's say it's us versus our parents.
Yeah.
We've got a thin cap blockage, let's say a 30% thin cap unstable blockage, and our parents or our grandparents have got a thick cap 50% blockage. Now that 50% blockage is a thick cap blockage, gradually progressive. After 10 years it will become 70, another 10 years it will become 80, but it will not be life threatening. As compared to a younger individual, you have a 30% thin cap blockage. Any weekend workout, weekend marathon, weekend binge drinking, emotional stress, physical stress, even exposure to cold, suddenly the 30% plaque will rupture.
Okay.
And it will cause 100% blockage and game over, sudden death. So this is why thin cap blockage, the cause of thin cap blockage could be many things. As I told, it could be stress, it could be inflammation, it could be COVID per se, it could be because of diabetes, hypertension, smoking, vaping.
So there are many
recreational
causes.
drugs.
Yeah. There are many
Absolutely.
factors that could, affect this. But also, what are the earliest warning signs that people usually ignore? Because people do not know about these signs and that, eventually affects them. So what are the earliest warning signs?
So earliest warning sign, first of all, you should identify what pain is cardiac and what pain is non-cardiac.
Right.
If somebody can pinpoint, I have pain here or I have pain here, that's not cardiac.
Okay.
Cardiac pain will be like 1 or 2 kgs of weight on your chest. The moment you start walking, it is increasing. The moment you start resting, it decreases. The moment you go uphill or uphill the stairs, the pain starts increasing. It may radiate to the jaws, it may radiate to both the arms, it may radiate to the back. Sometimes you may have severe sweating. It is cold outside, but still you are sweating. So these are classical angina. Now there is a subset of population who will not have classical angina. They will have something called as an angina equivalent. So angina equivalent could be shortness of breath, exertion, acidity, gastritis, especially females, diabetic populations, elderly people will not have classical angina, they will have angina equivalent.
Yeah, exactly. Many people had this confusion as well, that if they are dealing with gastritis or any other, or maybe acidity, but they do not know how to differentiate between the pain that is related to heart, or if it is gastritis or acidity. How can a normal person differentiate between the two?
So one thing, if your regular acidity is not getting relieved with ENO or antacids, think cardiac.
Okay.
If the shortness of breath is occurring after the age of 50, and especially if you are a diabetic population, do not think it's asthma.
Okay.
And the moment you say that, when I'm sitting, nothing happens, the moment I start walking, the shortness of breath increases. Or I have shortness of breath while sitting, I'm fine, but the moment I lie down, the shortness of breath increases. So these are classical markers that this is cardiac asthma or cardiac problems, not a asthma problem. A heart disease or probably an asthma will not kill you, acidity or gastritis will not kill you, but heart attacks can definitely be fatal. So you should be on lookout for these symptoms, especially after the age of 50.
Right. But is it true that the symptoms in both men and women, are they both different, or do the symptoms remain same?
So especially as I mentioned, male patients will have classical typical anginal symptoms. Females, the pain carrying nerves are blunted. They will not have classical chest pain. They might just have shortness of breath, uneasiness. The classical history will be, I used to walk about 4-5 kilometers before, but now I get shortness of breath even after 500 meters or 1 kilometer. Earlier, my heart rate was about 50s or 60s, 60, 65 heart rate. Now my heart rate goes to 85, 90, 100. My blood pressure is fluctuating. My sugar is going haywire. So these are all telltale signs to know that there are certain things that means something big is going to happen.
Right.
So like we have a bank KYC, same way, know your numbers. 4 numbers are more important than all the 256 lab tests put together. Those 4 numbers are your pulse, which should be ideally between 60 to 70, your blood pressure, 120 by 80. Third thing is your fasting blood sugar, which should be about less than 100, ideally. Less than 120 is acceptable. And the fourth one is walking distance. So walking distance, you will be able to know. Earlier, I used to walk for about, let's say, 2-3 kilometers. Now I'm getting shortness of breath with even shorter distances. So if these 4 numbers are going haywire, this should be a red sign that you should go to a doctor immediately.
Right, sir. But we've also heard about a silent heart attack. Could you please explain to our viewers about what is a silent heart attack and how dangerous it can be?
So silent heart attack, especially diabetic population, elderly population, the pain carrying nerves are blunted. They will not have any chest pain. They might be thinking it's acidity, gastritis. They might be thinking it's shortness of breath. So those things, sometimes if this happens, do not consider it as acidity or gastritis. Do not consider it as asthma. Consult your doctor immediately. Get an ECG done. Get an echo test done. Get a stress echo done. If you have a family history, get some CT calcium score done, CT angio done. So the list is depending upon what type of risk factors you come into, you get those done. Do not ignore your symptoms. Even if you are an athlete, even if you are into gymming, you should not ignore your symptoms, because many times, classical history, a person has some chest pain, continues to run, goes for a marathon, suddenly he collapses. So one must understand there are 2 types of athletes in our country. One is a neo athlete, one is a true athlete. So true athlete is the one who's been exercising since childhood. And a new athlete is the one who started exercising after the age of 35, 40. And then he suddenly thinks, after gaining some financial independence, that now is the time to hit the gym. I can become zero to hero in one day. So you should understand, your competition when you hit the gym is not with a Bollywood celebrity or a Photoshop copy of a Bollywood celebrity. Your competition is not with the gym trainer, your competition is with yourself.
Right.
Suddenly, what happens in the gym? Caution is thrown out of the window, get the ACs off, let me sweat it out. Lack of oxygen, again a fertile milieu for cardiac arrest. Starts taking pre-workouts, testosterons, beta HCGs, hormonal supplements,
Yeah.
again goes out of the window. You will be very surprised, educated people still are taking testosterone, saying that it is a natural hormone, we should take testosterone or steroid. And you'll have all beefed up bodies with high blood pressure, infertility inside, depression inside, suddenly waiting for the bubble to burst.
So that also affects, like people also
Absolutely.
take powders, protein powders for that. So that also impacts our heart.
So that's what. So now there are three types of supplements which I'm gaining at. One, as I told you, is your testosterone or steroids.
Yeah.
I'll take a 30 seconds for that. Many times a testosterone injection is about $1,000, easy to get. But what people feel, if somebody has taken a testosterone or a steroid injection by mistake, there's a beta HCG washout which can be done. But people very conveniently forget to take the beta HCG because beta HCG is much more costlier. So they will be taking testosterone, they'll be taking steroids and gaining the side effects of all steroids without taking a washout if by mistake you've taken the steroid. So my message is, if somebody has taken a steroid by mistake, take a beta HCG washout. Ideally, better avoid steroids and testosterone at all costs. Number two, if your age is more than 30, new athlete, you have not been exercising before, then pre-workouts are not for you, especially if you are borderline hypertensive or diabetic. Because such happens, pre-workout turns you into a beast mode, your power increases, your exercise capacity increases, but your heart rate goes up, your blood pressure goes up. God forbid, after the gym, pre-workout, you've taken alcohol, it's a deadly cocktail mixture, probably froth coming out of the mouth, causing a sudden cardiac arrest. We have really had cases of 18 years, 20 years going to the gym,
People
having
actually
pre-workouts.
try to follow the trend.
Yes.
And in that, they go on to follow these pre-workouts, post-workouts, protein powders and all those things.
Yes.
Right.
So pre-workout is not for borderline hypertensive diabetic patients. Protein supplements, natural proteins you can take, whey protein up to some extent you can take, but you'll be surprised, majority of the whey proteins in the market, even if we have written sugar free, still will raise your cholesterol, raise your sugar levels. So do not go for imported brands, fancy brands, thinking that they will be helping me out, because some of them may contain sugars, may contain lipids, and they will increase your lipids and sugars both.
Right, sir. But as we're discussing about gym and intense workout, should people get their heart tests done before, getting into this?
So very important. Again, first is, if you're going to the gym for the first time, if you've not exercised enough, you should actually know your target heart rate first. Your target heart rate, like for example, I am 51 years of age. My target heart rate is 220 minus age into 85%. So 220 minus 51 is 169. 85% of 169 is about 150. So any exercise which increases my heart rate persistently beyond 150 is harming my heart. So anybody who's exercising in the gym should not, the moment he touches 150 on the treadmill or during weights, he should take it easy at that point of time, especially when my age group. So every age group will have a different target heart rate,
right,
depending on the formula I told you, 220 minus age into 85%. Second thing you should go when you go to the gym is you should at least get a stress echo done before you hit the gym, because stress echo, if somebody has not exercised before, again going for sudden stress can cause a thin plaque rupture and cause a sudden cardiac arrest in the gym. So that is not the right approach. Third thing, what you should do is, the gym you should be mixing between functional training, muscle strength training. So 2 days of, let's say, muscle strength training, 2 to 3 days of aerobic training, which could be anything, push-up, pull-up, burpees, cross trainers, Zumba, Pilates, whatever catches your fancy. And the third thing could be yoga, meditation, breathing exercises. So a healthy mix of all the three is vital when you hit the gym.
Right. But so as we are discussing about gym and, workouts, heart palpitations, fast heart rate, people associate this with, their workouts. But is it also related to some health disease? And should people be concerned about that or not?
So palpitations as such, palpitation means conscious awareness of one's own heartbeat. Heart rate, which should be about 60 to 70 or 60 to 80, goes to 110, 90, 110, 120. So let's say if somebody has got a pulse rate of 100, 110, as compared to somebody who's got a pulse rate of 60, 70. A car which is moving at 110 will consume more petrol as compared to a car which is moving at 60, 70.
Right.
So if somebody who's exercising well, his pulse rate will be 60 to 70. Somebody who's not exercising well, his pulse rate will be 85, 90, 95. So that is high heart rate. Second thing is, sometimes, especially females, say that I am totally okay, but suddenly my heart starts racing, goes to 140, 150. Is it stress? Is it anxiety? It could be anxiety, but you need to rule out whether there's a short circuit in the heart, which is called as SVT or arrhythmias in medical terminology. As cardiologists, we are either electricians or we are plumbers. So plumbers means we open up the clogged arteries, ballooning, stenting, angioplasty and stuff. Second is electrician. When there's a short circuit which is there in the heart, in such cases, we do a radio frequency ablation or a laser to break the short circuit. So there are 4 or 5 things which you can do at home if somebody is having palpitations. First, pressure on the eyeballs. Somebody is having a heart rate of 155, 160. Pressure on the eyeballs. This is number 1.
Okay.
Second is splashing of water on the face. Number 2.
Cold water or hot water?
Cold water. Splashing of cold water on the face is number 2.
Okay.
Carotid massage. This is my Adam's apple. Right side and left side, I can feel my pulsations. So if I feel my pulsations on the right side, gentle massage on the right side. Do not do it on both sides, you will faint, just one side. 3. Vigorous cuffing is 4 and straining its stools is 5. So these 5 things will help you break the short circuit. Generally this palpitations is seen, or SVT or arrhythmias are seen more in girls. Young college going kids coming with anxiety turns out to be palpitations, or people who are becoming pregnant for the first time. When we are doing the blood test, we find out that they have a short circuit in the heart. So these are certain things which we need to find out. By the time you reach the hospital, everything is normal, but nowadays we have loop recorders and monitors. You attach a small sticker to your chest, go home for 7 days, download an app on your phone. Every minute, every second your ECG is recorded. If there's any problem, it will come on your physician's mobile. What was your ECG at 2 o'clock in the night? What was your ECG when you were binge drinking? And suddenly the ECG will come on your mobile. You'll get a notification and you can call the patient immediately that this is not a normal rhythm and come and meet me immediately.
Right.
So this is how we can detect if you have palpitations.
Well, that's a new information that you've given, sir. But also, as we were discussing anxiety, stress, how much do stress, anxiety and lack of sleep increase heart attack risk?
Quite a lot. Stress, anxiety. Especially, I would say you have 2 people. One is a lean guy, let's say lean guy like me, who's exercising too much, who's doing everything right, but I have lack of sleep, or if I have stress with me, then I am worse off than a guy who's a little more obese, healthy, laid back.
Okay.
So a healthy, laid back guy who
is tension-free.
who accepts imperfections is much better than a lean guy who's a multitasker. So take things easy, accept the imperfections and search for your happy hormones. When we talk about happy hormones, there are 4 happy hormones which every youngster should be looking at. First is dopamine.
Yeah.
Dopamine is 20% of your happiness. Dopamine is your sense of doing, your professional well-being, how well you're doing in your profession. Second is oxytocin, 20%. It's like physical intimacy, your colleagues, your friends, your relatives, hugging. So this is 20%. Third one is serotonin, your social work, your religious responsibilities, going to the temple, meditation. That is another 20%. Bacha kya, what is left is 40% is endorphins. Endorphins is exercise.
Okay.
So all these 4 things are essential for relieving the stress and getting you right back on the track.
Also bringing those happy hormones,
Happy hormones.
in our body that we try to, we do not know how to release them or how to, generate them. But now I guess you've given us a great idea on how to work on these happy hormones. But sir, also many people, they often lose consciousness. Is it also related to heart ailments or not?
Very pertinent question, Shubhangi. When you lose consciousness, there are 3 causes.
Okay.
One is because of the brain.
Yeah.
So when you lose consciousness, somebody has lost consciousness, become unconscious. Then if it's because of the brain, you have features of stroke, slurring of speech, drooling of saliva, uprolling of eyeballs, weakness in the hand. And in that point of time, he might pass urine or stool lying down.
Yeah.
So that is because of brain.
Okay.
If it is because of heart, you'll drop like a log. There'll be no premonitory symptoms. absolutely no premonitory symptoms, and within 1 or 2 minutes, you will gain consciousness as if nothing has happened. And within 1 or 2 minutes, he'll become okay. A lady who's cooking on the stove suddenly will hit the gas cylinder, she'll burn her face. After 2 minutes, she'll realize what has happened.
Yeah.
Suddenly, a patient who's going to the bathroom will hit the head, fall down, have a big bruise in the eye. Real life incidents I'm talking about. Have a big bruise in the eye, and by the time he comes out, he will not remember a thing. His wife will notice it and get him to the hospital. So this is classical cardiac cause of consciousness. The third cause of loss of consciousness is a fancy way of saying vasovagal syncope, or a fancy way of saying somebody fainted. 10 people in the class, one person drops down because of dehydration or sun. There's a death in the family, somebody falls down. Somebody sees the sight of blood, suddenly passes out. But in that case, you will not fall down suddenly. You will have a premonition that I'm about to fall, and you will hold on to something, and the injury will not be grievous.
Okay.
So when you have a cause because of heart, you've lost consciousness because of heart. Again, as I told you, there are two causes of that, either electrical or blockage issue. So the loss of consciousness in diabetics especially, it could be either because of blockage in the heart, sudden blockage in the heart, and there's no blood supply to the brain, and you pass out. In such cases, the treatment is an emergency angiography, a mini angiography from here, see where the blockage is. If it is lot of calcium, if it is a lot of calcium which is there, then you break down the calcium, suck out the clots, balloon it, stent it, open it, the syncope is gone, or loss of consciousness is gone. The other cause is the electrical cause, especially seen in the elderly population, wherein the heart battery becomes weak. So like you see a wall clock, 1 or 2 minutes, the wall clock slows down. At that point of time, that 1 or 2 minutes when the heart clock stops, suddenly the blood supply to the brain decreases and you pass out. By the time you reach the hospital, everything ECG is normal, you say everything is normal. So therein lies that ELR which I was telling you, that monitor to see, or you do an EP study to see whether the heart conduction is weak. If the heart conduction is weak, he becomes a candidate for a pacemaker. So pacemaker is the size of a matchbox, traditionally implanted below the collarbone. Now we have pacemakers which have a size of a vitamin C capsule. We do not require any cut here. It goes through the leg vein, no scars, no incisions. Patient goes home the next day. We were the first in North India to implant a dual chamber leadless pacemaker very recently.
Oh wow, that's a nice thing. So I would say this is a big thing, big breakthrough as well.
Absolutely.
But sir, as we're discussing real life situations, in the moment, if someone feels that this is the moment he or she might be going through a heart attack, what can that person do immediately?
So first thing is, see if you have classical symptoms as we discussed. The 3 tablets which one should have at home. One is a chewable aspirin, 325 milligram of chewable aspirin. If he cannot chew, you dissolve it in a spoon of water and give it to him. Second is 75 milligrams clopidogrel, 4 tablets. He should be immediately given, they can swallow that. And third is 80 milligrams of statins. Aspirin alone will reduce your death rate by 22%, WHO data. If all the 3 medicines are given, they will reduce your death rate by 44%. Because these are the medicines which are given by the emergency doctor once the patient reaches the hospital and before the cardiologist arrives. So these are the medicines to buy time and save cardiac muscle.
So these are like pocket drugs that we can have?
Yes, this is called as a loading dose. A 500 rupee in your wallet, a credit card in your wallet will not save your life, but a loading dose in your wallet or in your pocket will save your life, your friend's life, your co-passenger's life, your spouse's life, your relative's life.
Also, sir, in this situation, what is a golden hour? Many people do not know about it. I want you to explain it to our viewers. What is this golden hour and how crucial it is?
So when you have a blockage, the heart muscle is dying suddenly. So in that case, within 30 minutes, if you can reach the hospital, the earlier you reach, the better it is. And gradually as the time progresses, the heart muscle starts dying. When the heart muscle starts dying, the heart muscle becomes weak. There is no medicine to revive a damaged cardiac muscle. Any cardiologist who invents a medicine to revive a damaged cardiac muscle will win a Nobel Prize. Till that time, time is muscle, time is of essence. As for our certifications are concerned, whenever the patient comes with a heart attack, there is something called as door to needle time. That means the patient reaches the hospital door to you putting a needle should be less than 30 minutes, and door to balloon time should be less than 60 minutes. That means to open up the artery, it should be less than 60 minutes. Otherwise, the license of the doctor and the hospitals is in jeopardy, because this is what primary angioplasty is. Many times people say, notoriously say that we were pushed into doing all this, but this is what the guidelines say, because time is muscle. Sometimes you may just lose a patient, or as we discussed earlier, the heart failure the heart attack can convert into a cardiac arrest, and when you have a cardiac arrest, the chances of survival is less than 5%.
Okay. But sir, is heart damage reversible after a heart attack?
So that's what, if the patient comes within the window period, it is a hibernating myocardium or a hibernating or sleeping heart muscle, immediately it can be woken up. But if you are above the 1 hour window period, then the heart muscle starts dying down, and then the heart muscle becomes weak. You go into a stage called congestive heart failure. That means there you have shortness of breath now on minimal exertions. The moment you lie down, you become short of breath. Heart functioning, when the heart functioning becomes less than 35%, it is equal to end stage cancer. Only thing is, the cancer guy knows that I'm going to die. Less than 35% person does not know that he's going to die. Three things happen when your heart functioning goes below 35% in a case of congestive heart failure. One is what the patient sees, one is what the doctor sees, third is what nobody sees. Patient sees this classical shortness of breath while lying down. The moment he gets up, he starts feeling better, because heart pumping is low, blood is not going forwards, it is going back into the lungs are getting congested, and the abdomen is getting swollen up, the legs are getting swollen up. So if you have a leg swelling, abdominal swelling, shortness of breath, especially coughing during lying down, is a classical symptom of congestive heart failure. Second symptom is what the doctor says. Doctor sees as pump failure.
Yeah.
Your heart pumping is only working to 35%. So all organs are receiving only 35%. Brain, which should receive 1 liter of blood, is receiving only 35%, risk of stroke. Kidneys receive less than 2 liters, again risk of kidney failure. Intestines are receiving less, multi-organ failure. So what the doctor sees is multi-organ failure. Third thing which nobody sees is the risk of sudden cardiac death.
Yeah.
So you must have seen people dying during their sleep, people dying suddenly. So they are the ones who have a low heart functioning. So such patients, you must have seen people getting shocked in the movies, or AEDs being there in the shopping malls, or defibrillators. So such cases become later on candidates for implantable cardiac defibrillators or ICDs. You must have seen recently a football match which was suspended because the patient had a cardiac arrest. It was, I think, between Denmark and Finland, if I remember. So both of them, so the Finland guy, the Danish guy had a heart attack during cardiac arrest during the football match. So proper CPR was done, he was resuscitated, and then he was implanted an implantable cardiac defibrillator. His name is Daley Blind. He now plays for Holland, and he plays with an implantable cardiac defibrillator with a low heart functioning.
But sir, what are the common mistakes that people often do in this situation when they are going through a heart attack?
So first is ignorance. The first stage is stage of denial. I don't have it, my neighbor has it.
Yeah.
Mine is just acidity. It will pass off. So that stage of denial has to go. Second is the stage of anger. Why did it happen to me?
Yeah.
The third stage is the stage of bargaining. If it has happened, okay, I should deal with it. Fourth stage is the stage of depression. And the last stage is stage of acceptance. The moment you move from denial to acceptance as early as possible, your life will be saved.
Yeah.
So many times, do not ignore your symptoms, because heart disease will be deadly. It will not give you time. It is not like a cataract surgery. It is not like a gallbladder, which can wait. It will let some winters go away, summers will come. It has to be immediate.
Yeah. But sir, also, what are the, what would you suggest would be the 3 top habits that everyone should inculcate into their lifestyle to protect their heart, to protect themselves?
So first thing, as I mentioned, like you have a bank KYC, same way, know your numbers. Those 4 numbers are very, very important. Again, I'll repeat: your pulse, 60 to 70, blood pressure, 120 by 80, fasting blood sugar of 100, post-lunch sugars of 140. Fourth one is your walking distance. If you feel that your walking distance more than 50 years of age and running distance less than 50 years of age, you feel that earlier I used to exercise more and now I'm getting increasingly short of breath, these 4 are the warning signs and symptoms that immediately consult your doctor, number 1. Number 2 is knowing your lipid levels is of paramount importance. Lipid levels are of various types. Indians, South Asians are more prone for a heart disease as compared to their genetic counterparts in the West, because your LDL levels, we have a sticky cholesterol called LP little a. That LP little a should be less than 30. So that is a single cardiac marker that is not dependent upon diet. If your LP little a is more than 30 and you have a strong family history, you should consult your cardiologist immediately, because this is a attack which is going to happen. The third thing, which is called as, if you have a positive family history, stress echo has to be done below the age of 40 once in 2 years, after the age of 40 once in a year for everybody. If you are a diabetic, once in a year for everybody. Positive family history, once in a year for everybody. If your stress echo is showing some changes, you should also get a CT calcium score done. CT calcium score will predict any future events.
Okay.
Calcium score of 0, no events. 0 to 10, mild risk. 10 to 50, moderate risk. More than 50, severe risk. So in such cases, then further testing goes in favor of an angiography.
Yeah.
There are 3 types of angiographies which are available. Now this is for the masses also. 3 types of angiographies which are available. There is a CT angiography, there is a mini angiography, and there is a major angiography. CT angiography is a very good test for somebody who is 30 years of age, less than 30 years of age. You want to rule out a cardiac problem, CT angiography is good. But CT angiography has got a major drawback. It has got a wide standard of variation. Let's say if somebody who's 50 years of age, diabetic, CT angio is going to confuse you more than convince you. It is going to say that 50% blockage here, 60% blockage here, that 50% can very well be 90 and vice versa.
Yeah.
So CT angio is not a good test for somebody who's 50,
So
but a very
what
good
would
test
be
for a
the
young patient.
one test that gives the clearest picture of heart health?
So that's what I'm saying. If it is less than 30 years of age, you can get a CT angio done. It's got a good negative predictive value. It will rule out. If you are more than 50 years of age and you have a positive family history, or if you have risk factors, get a stress echo done. Stress echo showing changes, go for a mini angiography to rule out if there's any significant blockage.
Yeah, right, sir. So as I could understand from our whole conversation is the fact that our heart health is in our hands. We need to watch out for signs as early as possible. We need to take immediate action. And I hope our viewers got clarity about what all, information they should have about the warning signs, the triggers, and we also got a lot of tips from you, sir. So thank you so much for informing us, for helping us, for guiding us through all this. And to our viewers, if you have any questions, then do leave in the comment section, and you can also leave any other topics that you want us to discuss. And for more such interviews, stay tuned with India TV.